Hello guys, so we just discussed regarding the basal ganglia, right? So before you study the basal ganglia, you have to know the differences between the nucleus and ganglion. These are very important, okay? Nucleus is nothing but a collection of neurons or the masses of gray matter located within the white matter. All of you know this thing, that if you look at the cerebral cortex, so the outer is your gray matter and inner is your white matter, right? So this is the thing. Now when it comes to the ganglion, what is a ganglion? The same definition, collection of neurons or masses, but it is outside the CNS. Okay, outside the CNS. Outside the CNS, brain and spinal cord will comprise of central nervous system because they are centrally located. Anything which is out of the central nervous system is your spinal ganglion, right? You see, this is a ganglion. What is ganglion? Collection of cell bodies over here, right? The collection of cell bodies together is called as a ganglion. And by the way, what kind of neuron will be here? The neuron that is present over here is called as your pseudo unipolar neuron. I think we talked about it, right? So this was the neuron. You see this? This neuron is called as your pseudo unipolar neuron. And by the way, if you remember that I told you that pseudo unipolar neuron is having two important processes, right? One is called as a central process and the other one is called as your peripheral process. So this is the important thing. Next, what did I tell you? I told you that basal ganglia, right, is divided into four important parts. One is called as a corpus striatum. Next one you got it as a claustrum, substantia nigra and subthalamus. Actually, there is a different classification. There are different classifications. Completely we discussed about three classifications. Now out of these three classifications, this is the first classification, right? So in claustrum we discussed there are two important cells. One is called as a chordate nucleus, another one is called as a lentiform nucleus. What is this lentiform nucleus? Lentiform nucleus is nothing but the lens shaped nucleus. Okay, lentiform nucleus is nothing but your lens shaped nucleus. So that is what is called as your lentiform nucleus. So after this lentiform nucleus, the next nucleus you have got is a chordate. Now within the lentiform nucleus, two important things are there. One is called as the putamen, another one is called as your globus pallidus. Okay, one is called as your putamen and the other one is called as your globus pallidus. Now within this globus pallidus, there are two important things. One is called as globus pallidus externus, another one is called as your globus pallidus internus. Okay, globus pallidus internus and globus pallidus externus. So these are the two parts of your globus pallidus. Okay, so this is what is called as your lentiform nucleus, right? Now in this we know what is corpus striatum. Claustrum also we will see in the picture. Substantia nigra also will see in the picture, right? We have already seen, but subthalamus we cannot see it in a single picture. There is another picture like this, right? So you know that this part over here is called as your midbrain, right? So this part over here is called as your midbrain, and beneath the midbrain you have got what is called as your pons, and then down here you have got medulla oblongata. Okay, so midbrain, pons as well as medulla oblongata. Now within this midbrain, this particular structure, whatever you can see, what is this? This is called as your thalamus. Now beneath the thalamus, this region whatever is there is called as the subthalamic region. And subthalamic region is having what? It is having subthalamic nuclei. So subthalamic nuclei are located on the right side and even on the left side. This is the lateral view, right? So subthalamic nuclei. Okay. Next important thing is that, you know, this is the posterior ramus of the lateral sulcus. You know, in the lateral sulcus, how many ramus you have got? How many rami you have got? You have got three rami. One rami goes anteriorly, upward, forward like this. This is called as anterior horizontal rami. And next, another one is called as ascending rami. And the next rami is this one, that is your posterior ramus. So there are three rami over here. So what I'm doing is I'm making a section along this rami, lateral sulcus. So when I make a section along this lateral sulcus, this is how it looks. So this is called as your posterior ramus. This groove inside is called as your, or this sulcus inside is called as your posterior ramus of your lateral sulcus. So here, what are the important things you need to know? So we discussed something called as lentiform nucleus. So this red color one is lentiform nucleus, right? So where is the lentiform nucleus? You see this one, lentiform nucleus. What did I tell you? Lentiform nucleus, it is divided into putamen and globus pallidus. So where is this putamen and globus pallidus? See, the outer one is called as a putamen, right? The inner dotted region and the outer pink and the inner green region is called as, one is putamen outside, inner is called as globus pallidus. And here globus pallidus, again we divided into globus pallidus externus as well as globus pallidus internus. So all of you just look here, globus pallidus is divided into this dotted thing called as externus and this undotted thing where there are no dots which is clear, that is called as internus, right? Above that we have got caudate nucleus, below that we have got thalamus, okay? So between the caudate nucleus, between the lentiform nucleus which is lens shaped, and between the thalamus, in between all of these three, there is an inverted L shape or inverted V shape structure. This inverted V shape structure located more internally, right? So that is why you call this as an internal capsule. Now, as we have discussed, see this particular one over here is your internal capsule. Now, this internal capsule over here is having three parts. What are those three parts? You have got the anterior limb of internal capsule. See, this is called as the anterior limb. Okay, and this one is called as the posterior limb. And this is called as the gyno of the internal capsule. So, just look here. If I ask, this is your anterior limb, this is your posterior limb, and this is your gyno. If I ask where is anterior limb located, what will you answer? You have to tell that it is located between the lentiform nucleus as well as the caudate nucleus. If I ask where is the posterior limb located, what will you tell? It is located in between thalamus as well as, posterior limb is located between thalamus as well as the lentiform nucleus. Behind this, whatever structure we have got is an external capsule because it is more externally located, right? So this capsule over here is called as your external capsule. And behind this external capsule, what you have is a claustrum. So I hope you have covered all of these things, right? Now, this is second classification. What is the second classification? Second classification is basal ganglia is divided into two components. So one component is called as your traditional component. Another component is called over here as your clinical component. So there are two components. One is called traditional, another one is called as clinical. When it comes to the traditional component, within the traditional component, you have got one is the lentiform nucleus, claustrum, caudate nucleus, and the last one is amygdala. Okay. When it comes to the lentiform nucleus, again, it is having what? Putamen. It is having what? Globus pallidus. Coming to the clinical components, we have got substantia nigra. We have got subthalamic nucleus as well as the thalamus. You know what is thalamus? Below the thalamus, what do you have? You have got subthalamic nucleus. And next, when it comes to substantia nigra also, within the midbrain, you have got a black substance called as, black is called nigra. So you call it as substantia nigra, black substance. So what did I tell you? I told you yesterday that basal ganglia is the one which will plan the movement, right? And next which will initiate the movement and which will transfer the movement up to where? It will transfer the movement to the thalamus, and thalamus will take this information and send it to the cortex, and from the cortex the neurons will come down and enter into your muscles and start the action. So this is what is the overall function of basal ganglia. So we have discussed in detail about that, okay? So this is third classification. There is a third type of classification. What is this third type of classification? Is that basal ganglia. Third type of classification is that basal ganglia is divided into three important parts. One is called as corpus striatus, another one is called as neurostriatum or simply striatum, and third one is called as paleostriatum. Corpus striatus in the sense putamen as well as globus pallidus. Neurostriatum in the sense putamen and caudate nucleus, right? Paleostriatum in the sense globus pallidus. You see here, if this is a picture over here and this is your caudate nucleus, right? So you see this is your caudate nucleus. So if you see here that putamen as well as caudate nucleus together, what do you call putamen and caudate nucleus together? You call it as a neurostriatum. And after that, globus pallidus and, right, globus pallidus externus and internus together you call it as a paleostriatum, and the remaining part you call it as corpus striatum, right? So in the pathways, right, yesterday we discussed three important pathways. One you call it as a direct pathway, next one you call it as an indirect pathway, and third one you call it as a nigrostriatal pathway, right? So basically we need direct pathway and indirect pathway acting simultaneously. what does this nigrostriatal pathway do is that it will make small modulations, small changes, okay, within the direct and indirect pathway. First, let us look at the direct pathway. This cortex which you can see over here is called, as I already told you, what do you call this cortex? You call this cortex as a motor cortex. Next, from the cortex all the way down this pathway, whatever you can see here, right? So this pathway from the cortex to the putamen, this is called as corticostriate path. Okay. Next, from the putamen all the way to globus pallidus internus or externus, it is globus pallidus internus, externus, globus pallidus externus. So till here you have got, what do you call B? B as pallido, right? Striatopallidal pathway. So this putamen over here is called as striatum. Striatum to where? Pallidus. Which pallidus? Externus or internus? Globus pallidus internus. So striatopallidal pathway. You see here, striatopallidal pathway. Okay. Next important thing is that from globus pallidus internus all the way to the thalamus, this is called as pallidothalamic pathway. You see here, this is called as your pallidothalamic pathway. And final important thing is that from the thalamus all the way up back to the cortex is your thalamocortical fibers. So here I have written it as thalamocortical fibers, because from the thalamus it is going to the cortex. Okay, right. Once after entering into the cortex, what is its fate? What will happen to the fibers? What will happen to the fibers is that, look here. So what did I tell you? What is this fiber going from the thalamus to the cortex? This is called thalamocortical, right? So look here, all of you just look at this picture. See, this blue color thing, whatever I have written here is your thalamus, right? And let me highlight this part. See, this entire part which I am shading with the yellow, this part is called as your cortex, right? So one is thalamus, another one is called as your cortex. So this part over here is called as your cortex. Now, what is this pathway over here? This one over here is called as your thalamocortical path. Thalamocortical path, right? Now, we have discussed here till thalamocortical pathway only. We don't know after that what is going to happen. What will happen after that is that this thalamocortical pathway is going to relay on another neuron. This neuron is called as upper motor neuron. From here, what is going to happen? From here, the signals are taken down all the way and they are relaying on another neuron, and that is called as lower motor neuron. Lower motor neurons are those which are not present in the spinal cord, rather they are innervating your what? Innervating your skeletal muscle. So whatever thought you had in the thalamus, that thought finally it is conveyed to upper motor neuron. From the upper motor neuron, the tracks are descending down, right? So from there to the lower motor neuron, and finally the muscle activity will happen. For example, let us say I thought to contract my muscle. Let us say my hand is on the table. I wanted to lift my hand. So if I wanted to lift my hand, within fraction of seconds, I got that thought to lift the hand. Yes or no? Let us say, yeah, I got that thought to lift the hand. So from my thalamus, all the signals went to the cortex. From the cortex, with the help of descending tracks are nothing but your upper motor neurons. With the help of descending tracks, the information came all the way down to the spinal cord. From the spinal cord, from the lower motor neurons, from the spinal cord, what happened? The information is relayed on to the lower motor neurons, and from the lower motor neurons, these lower motor neurons are innervating my muscles, and lower motor neurons will fire. When they fire with the help of electrical impulses, my muscles will contract. When they contract, what will happen? My hand is automatically lifted up. That desired movement is happening, right? So this is the thing. Second important, this is an indirect pathway. Now when it comes to the indirect pathway also, right, the same thing but little bit lengthy. So the first group of fibers which you can see over here, which are coming down all the way, what will be these first group of fibers? They're coming from the thalamus to the striatum. So obviously I have to call these group of fibers A, right? So I did not write it while I was teaching. That A is called as what? Corticostriatal path. corticostriatal path, right? So A is nothing but your corticostriatal path. Then what about B, right? So here B is going all the way from the striatum to the globus pallidus. So B, I can call it as what? I can call this B as let us say striatopallidal pathway, right? But what I will do is that I will just write it here. You guess the name by yourself. I mean, you think the name by yourself. So it is present between putamen and globus pallidus externus. Glutamen and globus pallidus externus. And where is the third fiber? From globus pallidus externus to the subthalamic nucleus. Why it is called subthalamic? Because it is present beneath the thalamus. So from the globus pallidus externus all the way till where? Till the subthalamic nuclei. Subthalamic nuclei. Now, from the subthalamic nucleus, you have got fibers going to globus pallidus internus. So, from the subthalamic nuclei, fibers are going to globus pallidus internus. Right. From globus pallidus internus, the fibers are going to the thalamus. Okay. So, from globus pallidus internus, fibers are going to the thalamus. Okay. Now, from the thalamus, where are the fibers going? From the thalamus, the fibers are going up into the cortex. So, F fibers from the thalamus, thalamocortical, thalamus all the way to the cortex. Okay. And once it goes to the cortex, what is going to happen? Again, the same story like this. Okay. So, this pathway is an indirect pathway. Now, compare direct and indirect pathway, which is a lengthy pathway. Indirect pathway is a lengthy pathway. Okay. And direct pathway is an not lengthy, it is a very shorter pathway in comparison with the indirect pathway. So, this was the thing which I told you yesterday. If you got confused, listen to this once again. Direct pathway is responsible for the flexion of my muscles. Okay. Why? The entire goal of teaching this is that, for example, whenever I wanted to flex my muscles, right, my flexors only should work, not my extensors. So, when I am able to flex my muscles, see, I am able to flex my hand. When I am able to flex all my fingers, all the flexors here, right? When I am able to flex my elbow, all the flexors in the forearm has to work. At that moment, all the extensors should relax. If extensors contract, my hand is not in a flex position, it extends like this. Clear this? So, what I am telling you is that whenever flexion should happen, whenever contraction is happening here, on the other side, relaxation should happen. And whenever relaxation is happening on the other side, contraction should happen. So, this is the rule. So, for contraction of the muscles, we need a direct pathway. For relaxation of the muscles, we need indirect pathway. Okay. So, how does direct pathway works? So, before you know the direct pathway, you have to know two neurotransmitters. One is called as glutamate. What is a glutamate? Glutamate is a neurotransmitter which will excite the neuron, which will activate the neuron. Okay. Next, another one is called as GABA. Gamma aminobutyric acid. So, what is responsible for GABA? I mean, what GABA is responsible for? It is an inhibitory neurotransmitter. Inhibitory neurotransmitter in the sense it will inhibit the action of a neuron. Okay. Glutamate will activate the next neuron and GABA will inhibit the next neuron. Okay. So, look here. Here, first important thing you need to see is that within the direct pathway, the blue color lines, we have got how many neurons? 1, 2, 3, 4. Out of these 4 neurons, neuron number 1, just look at neuron number 1. Neuron number 1 is releasing glutamate. It means this has a capacity to activate the next neuron. Neuron number 2 is releasing GABA. Neuron number 3 is also releasing GABA and neuron number 4 is releasing glutamate. Okay. Now, here one thing you need to understand here is that you see this neuron number 4. You see this neuron number 4 over here, right? This one, right? So, this neuron number 4, this one, this neuron number 4, right, is all the time activated. Let us say this neuron number 4 is like a kid, okay? He is all the time playing. Now, it is your duty as a parent, you have to go and control the kid. Now, once you lost the control, again he will start playing, right? So, neuron number 4 is like that. Neuron number 4 is all the time active. Why it is active? Because all the time it is releasing what? Glutamate. and all the time the glutamate is released in the cortex. Now all the time if the glutamate is released, don't you think your cerebral cortex will also be active 24/7? If the cerebral cortex is active, and moreover this pathway is what? This pathway is this direct pathway is responsible for flexion. So if glutamate is released again and again, what will happen? The signal from here, don't you think it will go to the descending neurons? I mean the upper motor neurons, from upper motor to lower motor, and then contract your muscles. So if this is if this is activating your cerebral cortex all the time, then all the time your muscles should be in a flexed position, in a contracted state. But whenever you want, you can contract. Now, whenever you don't want, you can relax. How is that happening? How is that happening is that neuron number 4 is all the time kept under a surveillance of neuron number 3, right? So what neuron number 3 will do is that it will simply release GABA. And what this GABA will do? This GABA, you see, this neuron simply releases GABA, and this neuron releases GABA, and this GABA will inhibit the neuron number 4, right? Whenever I want to contract, that time I will tell the GABA not to release GABA. So when GABA is not released, automatically fourth one will be activated, right? Whenever I want to relax, what will happen? I will tell neuron number 3 to shut down neuron number 4. So that time it will release GABA. So what is the entire story over here? First, I decided I have to contract. That thought process generated here. And this thought process all the way entered into your direct neuron first one. Direct pathway first neuron. And what did this first neuron do? First neuron is a glutanergic because it will release glutamate. So first neuron has released glutamate. Now this glutamate fell on where? You see, this glutamate fell on neuron number 2. Why? Because glutamate is an activatory. So it will activate neuron number 2 or it will inhibit neuron number 2. It will activate neuron number 2. So it has activated neuron number 2. And once neuron number 2 is activated, neuron number 2 is a GABAergic neuron. So it will start releasing GABA. And what is the action of GABA? GABA will inhibit or activate? Inhibit. So obviously it will inhibit the neuron number 3. If GABA is inhibiting neuron number 3, do you think GABA will be released here? No. If GABA is not released, do you think neuron number 4 is under any inhibitory activity here? Anyone is stopping neuron number 4? No. No one can stop now. So neuron number 4 will be activated and it fires and starts releasing what? Glutamate, like this. And this glutamate will obviously cause contraction of muscle. So this is how my muscle is contracted. Okay. Now, whenever my muscle is contracted, in the same way the muscle has to be relaxed also. So for that reason you need which pathway? You need indirect pathway. In indirect pathway, what is happening? In indirect pathway, what is released? Glutamate is released. Okay. So this glutamate is acting on neuron number 2. Neuron number 2, what is this? GABA. And what will happen? GABA is released. So once GABA is released by neuron number 2, this GABA will inhibit what? Neuron number 3. Neuron number 3 is also what? GABA. So when neuron number 3 GABA is inhibited, do you think any GABA is entering here? No, there is no GABA. When there is no GABA, then neuron number 4 is what? Glutanergic. So this is, what did I tell you? This will be all the time active. So what will happen? Glutanergic neuron will release glutamate. Okay. See, glutamate is released. And this glutamate will activate again what? Fifth neuron. What is fifth neuron? GABAergic neuron. So it starts releasing GABA. And this GABA should inhibit the next sixth neuron or activate it. It will inhibit the next neuron. So what will happen? If it will inhibit the next neuron, glutamate is not released. So when it is not released, cerebral cortex is not activated. So your muscles will relax. You see how these two pathways are happening? So these two pathways, like direct pathway and indirect pathway, they occur simultaneously. The moment direct is started, indirect is already been started, right? So both of them, they start at the same time like this. So obviously the same concept goes with the dopamine also, okay? So we have already discussed in detail about the dopamine, that is pars compacta, one is pars reticularis, okay? That is a nigrostriatal pathway. So direct and indirect, direct is what? Short length. And what do you mean by indirect? Indirect is a longer length. Next, direct is stimulatory, whereas indirect is inhibitory. Okay, it will stimulate what? It will stimulate your upper motor neuron and lower motor neuron, and here it will inhibit upper motor and lower motor neuron. So obviously what is going to happen at the end? There will be muscle contraction and here there will be muscle relaxation. Okay. So this is all you need to know regarding the basal ganglia, guys. So thank you so much for watching my video. Goodbye.